Let me pose a question. What do Oprah Winfrey, Jillian Michaels, and George H.W. Bush all have in common? They are affected by something that over 27 million other Americans have also been diagnosed with. This issue is so common that 50% of people go undiagnosed for most of their lives. I'm talking about thyroid disease. The thyroid is a tiny, bow-shaped gland in the neck area that is responsible for the production and secretion of several different hormones. The hormones in the thyroid are responsible for metabolism, body temperature, skin moisture, and cholesterol levels. Without them, our organs cannot function properly. But what happens when all of that goes awry? In short, we are left with a problem, a thyroid that functions incorrectly. Now, there are two different ways that your thyroid can be out of whack. An underproduction of the hormones called hypothyroidism, or an overproduction of the hormones called hyperthyroidism. In uncommon cases, both of these can occur, making it extremely difficult to diagnose. Hashimoto's disease was discovered in 1912 in Japan by Dr. Hashimoto and is the most common reason why hypothyroidism occurs in the United States. It is an autoimmune disorder in which the thyroid becomes inflamed and damaged and is unable to produce the right amount of hormone that the body needs. So why does this happen? Well, the answer to that question is not completely known, but this autoimmune disorder is a result of the body attacking itself, in this case through the thyroid, as though it were an intruder. According to the Thyroid Research Journal, most thyroid diseases are more common in women, and Hashimoto's is no different, as it is between 5 and 10 times more prevalent in women than in men. This disease typically presents itself between ages 40 and 60, but can transpire before that. The disease itself tends to be genetic and runs in the family. Environmental factors can play a part in who is susceptible to getting Hashimoto's disease. People who have already been diagnosed with type 1 diabetes, Addison's disease, and rheumatoid arthritis are more likely to be diagnosed with this disease. The hardest part about diagnosing this disease is the commonality of the symptoms. These symptoms manifest themselves in the same way that other types of hypothyroidism do. Among them are depression, fatigue, weight gain, intolerance to cold, dry and thinning hair, and joint pain. Some of the most iconic symptoms of this disease include a round, puffy face and a hoarse voice. Not often, but sometimes, Hashimoto's disease can cause adverse symptoms which are standard to hyperthyroidism. Many people who have thyroid diseases, especially Hashimoto's, never even know it because the symptoms either don't present themselves or they are so common. My mother had a tumor growing on her thyroid as a result of Hashimoto's disease and didn't know it for over 20 years. Now, doctors will run a series of lab tests to confirm the diagnosis. They check the thyroid antibody count for several different hormones. The Journal of Clinical Endocrinology and Metabolism states that you should see an endocrinologist, which is a doctor that specializes in hormone-related problems, in order to get a proper diagnosis and treatment plan. As far as treating this disease, there are several different ways. Most people will just need a hormone replacement, which typically comes in the form of a pill. In more serious cases, or if a tumor or goiter has developed, surgery may be involved. The surgeon may remove part of or the entire thyroid and would then put you on synthetic hormones to replace what your body no longer has the ability to produce. There is no cure or prevention for this, but the medications do help once you give your body time to adjust. The prognosis for Hashimoto's disease is good. With a proper treatment plan, people can live a normal and healthy life. Now, it is especially important for people living with thyroid problems to stay active and eat healthy. They should see a doctor once or twice a year to make sure that the medication is still working properly. According to the Journal of Medical Case Reports, Hashimoto's disease is very underrecognized. With millions of people undiagnosed, it is important to take care of ourselves, trust our bodies, and to stay informed.